Thank you. Welcome to session 2. Could I have the first slide, please? Okay, so we are going to look at some insights and predictions for 2021 and beyond. Next. Maybe we should start with the definition of digital health. Next slide, please. Digital health, this definition comes from HIMSS 2020. It says that digital health connects and empowers people and populations to manage health and wellness, augmented by accessible and supportive provider teams working within flexible, integrated, interoperable, and digitally enabled care environments that strategically leverage digital tools, technologies, and services to transform care delivery. It's a bit complex definition, but there are some important points there that we can take up in discussion by the panel. Next slide, please. Now, digital health is not new to Malaysia, but we did not call it digital health in those days. From the early 1990s, there have been many developments in what we used to call health IT. Subsequently, we used the term telemedicine, telehealth, e-health, and now we are comfortable with digital health. Over the years, we moved from a provider-centric focus to person-centric focus or patient-centric focus. We began to recognize consumers of healthcare as not just passive recipients, but also as empowered users who would use healthcare in their own interests. Now, COVID-19 has had a dramatic effect on the rollout of digital health, on the utilization of digital health. And the panel will take up this topic over a period of time. But increasingly, if we are going to move to a digital nation and manage this COVID epidemic, we need to take a whole country approach, a whole of society approach. In fact, a global approach is required. And with this, I will go on to introduce the panelists to you, or they have already been introduced to you, but I will let them, I will ask them some questions, and we will look at what digital health trends could look like. The first panelist is Dr. Feisul. He's a public health physician and Deputy Director, Disease Control Division of the Ministry of Health. Dr. Feisul, could you comment on the progression of global digital health trends over the year, how they rise and fall, and what categories are coming into popularity, and the impact COVID-19 has had on digital health? Dr. Feisul.
Thank you very much, Dr. Ajay. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good morning, good afternoon, everyone. Firstly, thank you very much to the organizers for inviting me, and thank you very much to my fellow panelists as well for joining me in this session. Could I have my first slide, please? So, going to the first question that have been posed in terms of progression of global digital health trends, I would like to make 4 key points here. And all this information I have derived from a report that's available in the public domain, and I align myself to the opinion provided in the report. So firstly, I would like to talk about the evidence for digital health. The figure that you have right now, the horizontal axis is the years from 2007 to 2020, while the vertical axis is the number of studies. So these are published digital health efficacy studies. The gray bars shows the studies which are either randomized control trials and observational study, and the blue bars show systematic reviews and meta-analysis. So what you can see in terms of from the figure, the literature is growing. That's one. And secondly, you will see that the number of systematic reviews and meta-analysis in terms of percentage and numbers as well have increased over the years. So basically, the point is here, in addition to the literature is growing, you have evidence now that support inclusion for digital health tools in the treatment guidelines based on the systematic reviews. And thirdly, which is not in the graph, is independent organizations continue to highlight the need for high quality evidence. So that's my first key point. Could I have the next slide, please? My next key point, still on the same question, progression. Looking at the trends for the digital health. Okay, so you have different challenges for differing specialties. All right, the figures now that you see shows on the horizontal axis no studies up to multiple meta-analysis. That's the full range. Whereas on the vertical axis you see negative studies and positive studies. So where you want to be really is on the right upper quadrant. That means a lot of robust evidence with a lot of positive results. And in the field that I do, NCDs, you will see a lot of it in that space. All right, in that you could see, for example, on COPD, on heart failure, on depression, on diabetes, on exercise. The next best box, as it were, will be the next box, candidates for adoption. Again, you will see a lot of NCDs here. And where you don't want to be is at the bottom, and you will see some of the examples shown in this report is on hyperlipidemia and on self-diagnosis. So two things that I would like to highlight from this slide is firstly, developers innovating new digital health tools would do well to leverage on areas that have growing evidence of efficacy. And secondly, do not follow trends blindly. Follow the trends instead. Definitely, we can discuss about this later on during the Q&A. Could I have my next slide, please? My third key point in terms of health apps. So, digital health is a lot of things. Let me just, my interest in on health apps. I'm just really focusing on health apps for the next two slides. We see cyclical global trends in a lot of things, and you see cyclical global trends in health apps as well. The figure that you see, the horizontal axis is again the years from 2010 to 2021, and the vertical axis is the number of apps released by year. The blue bars represent new apps currently available. The gray bars represent apps which is no longer in store, and the blue line represents the percent attrition by year. So the report stated that we are currently in the expansion phase where you get a lot of apps currently available with very low attrition rates. Anyway, the key points for this slide is that this data alone, because of COVID-19, will not reflect the dynamics in 2020 and 2021. So we need to look at the nuances of what's happening with COVID-19. And another interesting point from the report, not from the figure, is that among the apps pool from the app stores, 51%, half, had under 100 downloads, right? And thirdly, developers not only need to build apps, but also create a plan to drive uptake and differentiate. As more and more apps becomes available, it is not just because the app can do A to Z that people want to use it. You would need to think about the context where it is being used and how do you incentivize people to engage with your app. Could I have my next slide, please? And my fourth key point on the question on progression and global digital health trends, I like now to focus more on NCDs. I'm glad Dr. Mohan and Dr. Ko also mentioned about the NCDs with regards to COVID-19. The figure that you show, that is being shown here, the green boxes represent diseases and the blue boxes represent wellness. And you can see, and the horizontal axis is 2015 to 2020. You can see the number of apps for like healthy well-being has decreased, and the number of apps tackling diseases have increased. And when you look at the green ones and looking at it to the circular chart on the right, this is focusing just on NCD related apps. The majority is on mental health and behavior, followed by diabetes, followed by heart and circulatory system. So the three points I'd like to make from this slide is that the apps are increasingly focused on health condition management rather than wellness management. Mental health, diabetes, cardiovascular disease related apps account for more than half of the disease specific apps. And what's not on the figure, 83% of apps are installed fewer than 5,000 times collectively, accounting for less than 1% of total downloads. Right. And my last slide, please. This is with regards to the, could I have the next slide? With regards to the second question posed to me by Dr. Jai. The COVID-19 impact on digital health, can we expect the trends to continue? What I've done on this slide is I've just taken 5 aspects, as it were, of the trend for digital health. Firstly, on diversified commercialization pathways. Secondly, on employers and insurers having a more significant financial players, knowing in fact that I have a fellow panelists representing the insurance here. Third, COVID-19 has severed face-to-face physician interaction. 4, public is taking health management in their own hands. And 5, digital health devices to monitor a range of vital signs. So maybe, yes, that's my personal opinion. I would like to pose that to members of my panelists and also to the participants as well, whether you would agree or disagree with me. And for the sake of time, I'm not going to elaborate why I said maybe and yes for this. It is a personal expert opinion, but I'll pass back to you, Dr. Jai. Thank you very much.
Thank you, Dr. Feisul. We will go on to the second panelist, Mr. Karthik Tirupathi. Now, how will the COVID pandemic turning into an endemic change our responses in healthcare services and delivery? Singapore is already planning ahead in this area, as are many other nations. And would a fully digital hospital be part of the solution? Mr. Karthik?
I'm sorry. Thank you, Dato, Dr. Jai Mohan. Let me quickly get my presentation up. So while the presentation is coming up, one of the things that I wanted to do was to quickly give an introduction about my background. And so that will serve as a background for what we are trying to discuss today. The whole point about technology is that it is very pervasive, and the digital platforms are today making a big entry into healthcare. Just give me 1 second, I'm still a little, yeah. If you're able to see my screen now.
Yes.
Yes,
Carry on.
thank you. Yes. So Napier Healthcare is today the Singapore-based company that provides technology solutions to healthcare providers in 2 formats. One is the acute care and the other is the long-term care. In the acute care, we serve hospitals and clinics and the others, whereas in the long-term care, we serve the home care, the residential care, daycare, and so on. We are present in 9 geographies, from Australia, New Zealand, to Southeast Asia, to India, to the Middle East and Africa. So a lot of these thoughts that I have gathered here today are basically based on our experience working with acute care and long-term care facilities. So to answer your question, I think there are 3 points I'd like to make. The first one is that I don't think there is a problem in terms of capacity, but the problem statement that we all have is more in terms of accessibility to healthcare, the equity, and also increasingly in the last 18 to 24 months, the problem of cyber security that we have seen. What this requires us to do is reimagine healthcare completely. And I will talk about that. We have to move away from our mindset of being tied to the physicality of hospitals or residential care, nursing homes, and so on, to looking at something of a hybrid in the medium term and probably purely digital in the long term to the extent of 80-90% of our healthcare. And then I will obviously pitch for being a technologist myself all my life. I'll pitch for what these digital technologies mean for us in the long run. Yeah. So when you look at the accessibility, equity, and the cyber security problem, if you look at Malaysia today, Malaysia has sufficient healthcare workers. The goal of WHO suggested goal is 1:225 in terms of the healthcare workers to the population, whereas Malaysia is at 1:186, which means you're already better. And yet, as the pandemic has shown, we are now struggling in Malaysia against the pandemic for various reasons. I don't want to go into the reasons thereof, but I think the evidence is in front of us that we are struggling, the healthcare system is struggling, and this is not just Malaysia. I think almost every country in the world is struggling today with the pandemic and the onslaught that it is having on the healthcare facilities and infrastructure. At the same time, if you look at the spending in Southeast Asia from currently $425 billion on healthcare, this number is likely to go almost up to $800 billion by 2025. That's the kind of growth that we are looking at. Yet, when you look at the needed support for all of this, there are a few things that I think make us very optimistic. One of them is our internet penetration rate. Barring probably Timor-Leste, Laos, and Myanmar, the rest of the Southeast Asian nations have anywhere between 70 to almost 98% internet coverage. Happy to share that in this report, Malaysia is at 89% and stands second in terms of penetration. So there is a good cause for cheer for us that, you know, we can still catch up on some of these things that we need to do in putting up the healthcare digital infrastructure and making accessibility more pervasive for everybody. The population, 50% in Southeast Asia is urban, so that still leaves another 50% unconnected to this whole thing. Now, the last point I do want to mention on this problem statement is about cybersecurity. Going by various reports, the number of incidences of cybersecurity related to hacking in the last 18 odd months have grown by 200x, not 10%, 20%, 100%, 200x. Just to give you a record that I pulled off from the HIPAA journal, the average 3.3 million health records were breached every month between July 2022 to June 2021. So what this means is that there are people who are looking to fish in troubled waters. They are hacking, they are demanding ransomware, and taking payments from things like Bitcoin and so on. So I think that's the point. So with that, the problem statement I would conclude is about accessibility, equity, and cybersecurity in front of us in the face of the pandemic that we are facing today. Moving on, if we were to reimagine the healthcare, what are the things that we have to look at? So if you see by the history of pandemics, Black Death resulted in almost 200 million deaths. Flu between 1980 to 1920, which is the Spanish flu, was about 15 million. AIDS is about 35 million. COVID is about 4.2. So that's just kind of putting things in perspective about how do we pandemic proof ourselves. But at the same time, there are a lot of COVID-19 era policy waivers that are there in front of us. And I do expect that a lot of these will become permanent. You could be looking at things like the emergency use, and future pandemics will probably necessitate a response like this. How do you quickly move through the emergency use to an FDA approval and so on and so forth? I think those are some of the things that we have to look at. So when you look at these things, what it means to us is that the shift of care out of hospitals is not new, but it's just that it is being now accelerated. And I also take a lot of confidence based on the last slide that Dr. Feisul shared, where he is talking of the digital health being accelerated a lot more. But my point is, all of this will result in what I call as a new health economy. And this is the future of healthcare, where the delivery and innovation of healthcare solutions will be now guided and accelerated by the consumer needs, and will focus on directly connecting the provider and the patient, removing a lot of intermediate steps, not necessarily intermediaries, but a lot of intermediate steps needed. So this will usher in what I call as the care anywhere era. That's the point we're trying to make. So what are the components that go into this digital innovation? I want to spend a few quick minutes talking about it. There are AI infused solutions. AI is nothing to be worried about. Artificial intelligence is at best a decision-making tool. No man can create an intelligence beyond his own intelligence. So it is unlikely that any intelligence will overtake us or the planet and result in the science fiction kind of mystery things that you hear. At the same time, you're looking at telemedicine. Telemedicine is very interesting. I've been tracking it pretty much even before this. Telemedicine has now become a little more transformative in the way it manages things. It is now being termed as virtual care. So it is not just telemedicine, it is going well beyond telemedicine. So I think that's the point that you want to look at. And the IoT and chatbots, IoT stands for Internet of Things, and the chatbots are again artificial intelligence powered help that you can get from the various websites and so on. The IoT have devices at the edge of the internet, which basically means that I can monitor elderly at home, I can deliver care at home, I can do cameras, I can look at even infusing AI there and predicting fall risk, for example, and so on. But all of this is, again, just to get back to the point I made earlier, this is because there is a 70% decline in the in-person doctor visits and about 65% decline in diabetes and cancer patients coming into facilities as per the report that we have seen. And which means we have to therefore provide a greater digital connect to all these people that want to be served by the healthcare system. I want to quickly move on to the last point, which is remote patient management. And in this remote patient management, I want to talk about one of the interesting projects that we did in Singapore in the eastern suburb called Chai Chee.
Karthik, you just have about a minute to conclude.
Yes, I will wrap up very quickly. So what we did was we set up devices in the homes of elderly between 45 to 78 years, and also delivered telehealth services. And we ran it for about 6 months, covering blood pressure, blood glucose level, heart rate, and weight monitoring based on devices that were needed for it. But our study findings were very interesting. We thought the elderly may not like the idea of all of this and were technology unhappy, but it turned out just to be the opposite. 91% said it was easy to use, and 95% of the patients were very satisfied with the program. What this told us was the elderly are most likely to want to continue using the telehealth for the management of their condition. So this whole myth about people not willing to work with technology was busted as long as the technology was easy to use. With that, I would like to conclude and thank my fellow participants and also Dr. Dato, Mohan, for this opportunity to speak to all of you with my thoughts. Thank you very much.
Okay, thank you, Mr. Karthik. We'll go on to Dr. Ashish Kanakia, who is Director and Head of Medical Business Management at Prudential Assurance Malaysia, Berhad. Now, Dr. Ashish, would you address this topic? What would be the role of big data and data analytics in digital health in the future? What impact do you anticipate this will have in financing healthcare in the future? Dr. Ashish?
Thank you, Dato, for your question, and thank you for the organizers for inviting me for this conference. Very happy to share some insights that we have and some of the things that we are working on to support the digital health. First, let me quickly introduce myself. I'm Dr. Ashish Kanakia, working for Medical Business Management in Prudential. And what Prudential is currently focusing on is to deliver the health. So traditionally, insurance has always been looking at how to support the customers, the patients when there is actually an acute illness. But now we are focusing more on how to maintain the good health for the customers at every stage of that journey. Okay, and we have created a very unique app, Pulse by Prudential, which integrates and brings all the different aspects about supporting individuals on the health front, either by symptom checker or supporting on the diets, the step counts. There are different aspects that all comes together in this Pulse by Prudential. To address the question by Dato is basically, first and foremost, how I would try to address this is by telling what I understand by digital health. Digital health is basically where technology and health comes together to support and improve the health of the individuals. And digital health is playing a very important role. It's estimated by some research that it can create almost up to 100 billion in value by 2025, and that's a significant growth, increasing from $37 billion in 2020. And what are the key drivers for digital health? It's basically the aging population. There is a significant number of individuals who age more than 65, who will require the support, healthcare support, and there is a lot of increase on this particular front. So which is again driving the digital health. Supply constraints, and when I say supply constraints, this is from Pan-Asia perspective. The number of doctors are relatively less to cater to a population, and also it's the same kind of situation for the nurses as well. There's also rising consumer expectations and growing financial burden, which is driving the digital health. But in addition to this demographic of drivers, there is the driver in terms of the technology. There are different things which are coming up. For example, telemedicine, the artificial intelligence enabled medical devices, wearable medical devices, 5G technology, electronic health records. All this are playing an important role and actually reshaping how are we looking at healthcare, how we are connecting to the healthcare professionals, and how certain decisions are being made. To achieve a successful outcome, for various platforms which provides the healthcare, it's very important that there are interest and alignment between the different stakeholder, which includes government, the payers, providers, physicians, and patients. And when there is the interest, is being looked at, the important thing is to identify what are the pain points for the different stakeholders and how do we address that. The integration of the different resources, either it could be online or an offline resources, and also in terms of how we create a seamless and sync up between the different platforms, different service providers, and how do we create a flow which is going to be very easy for the consumers. The healthcare ecosystem can deliver right care by creating a network of the healthcare service providers across the care settings, using a system of intelligence that leverages on behavior, social and health data, and a strong technology backbone that enables the data insight and to flow between the care providers. So that's very critical to ensure that we are able to get a right kind of ecosystem available to take care of the health needs of the consumers. So what are the different transformations which are happening? I'm not going to go into a lot of details of there are lots of transformations which is happening, and that's revolutionizing the healthcare delivery. But let me highlight on some key points, like the rise on demand by healthcare. The people are really aware of what they want, and they are demanding that. That is, as I mentioned previously, the big data in healthcare is available. It can support the lower medication errors, facilitate preventive care. The growth of wearable medical devices is really transforming and taking the entire healthcare delivery at a different level. The health data from the different apps, from the hospitals, from the insurance, all of this can come together. The variables can also provide this particular data. This can actually personalize the healthcare experience. The target, the insurance pricing. So normally what happens is that how insurance works is that it looks at the health information, the details about the customer's health, and then that drives the pricing for the insurance. So with more information available, there can be more accurate pricing. The insurance companies can incentivize the customers to improve the health. There can be gamification opportunities that can be developed.
Dr. Ashish, can you conclude in a minute or so?
Sure. So there is a predictive healthcare and artificial intelligence, which also plays an important role. And as shared previously, the blockchain, utilizing the blockchain to share the electronic health records between the different stakeholders can also make things very seamless and easier for the customers. What are the different types of the different healthcare ecosystems? It can be providing and broadening the access to primary care through appointment booking or telemedicine, improving health and wellness by symptom checker, the step counts, diets, expediting the access to acute care by making the medical record available, disease risk assessment, medical second opinion, and also in terms of the managing and monitoring the diseases like diabetes, kidney disease, and etc. And how this digital health is impacting the health insurance. As I mentioned previously, there is a lot of focus on customer centricity, utilizing the internal and external data to make sure that we are able to give a very personalized kind of services and engage with the quantified self-practitioners, people who want to monitor their own health and try to give them a very good customer experience. Variable technology is being utilized increasingly by the insurance company to engage with their customers. Artificial intelligence and machine learning is being used to identify frauds, identify health risk individuals, and do something different for them, incentivize them to improve the health. Also to understand what is the market trends and build predictive analytics. A couple of important points before I conclude. The data privacy is very important, and that's really something which insurance is looking at. So even while building the different ecosystems and health platforms, how do we ensure that the information is safeguarded so that there is a confidence building among the consumers? Value-based insurance is something which I think so most of the insurance companies are currently focusing on, to see how, in addition to not only cater for the needs of the individuals, patients at the point of hospitalization, but also at the point of when they are healthy, to how to continue to maintain that good health and do some preventive measures as well. So those are the things that insurance is really focusing on, and that's how it's impacting the digital health is impacting the insurance front.
Okay, Dr. Ashish, thank you very much. We'll proceed to the next panelist, Professor Tan Geok Chin, Professor of Pathology, Deputy Dean of Research and Innovation at the Faculty of Medicine, Universiti Kebangsaan, Malaysia. Your question: how artificial intelligence can shape the future of medicine, and how has the COVID-19 epidemic facilitated or impaired the rollout of digital health in healthcare? Prof. Tan?
Thank you, Dato, Jai, Mohan. First of all, I would like to thank the KSI for the invitations, and good afternoon, everyone. Are you able to see my slides already?
Yes, we can.
Okay.
Can you put it full screen? Yes.
Okay. So my first question is how AI can shape the future of medicine. So early this year, the Academy of Science Malaysia and MHC has come up with a framework called 10-10 SDIE. The reason is to propel technology innovations and economy of our country. And digital health and artificial intelligence are part of this 10-10 my SDIE. Hence, I have great interest in this particular area. So when we talk about AI, the first thing that comes to our mind is evil robots trying to conquer the world, destroy humanity, just like what Mr. Karthik was saying just now. But is that so? The question is. So I think everybody knows who Sophia is. Sophia is the most human-like robots produced by Hanson Robotics in 2016. Sophia uses AI for speech and general reasoning, and she's capable of facial expression. Interestingly, she has a citizenship from Saudi Arabia, the first robot who has a citizenship. Very interesting to note and debatable. So when it comes to AI, the three terms that always appear is artificial intelligence, machine learning, and deep learning. Artificial intelligence basically is machines that is capable of human thinking. Machine learning is a subset of AI where machine uses algorithm to analyze data and make decisions. Whereas deep learning is again a subset of machine learning, and it uses a multi-layered algorithm for data analysis and make decisions. So deep learning is particularly useful when it comes to medicine research, and perhaps all other areas as well. Give an examples. So a 40-year-old woman noticed to have a breast lump and went to see a GP. A GP examined and advised her to go for a mammogram. So on the third day, a mammogram was performed, and the mammogram shows an radio opaque lesions with speckles, and the radiologist wasn't very sure whether this is benign or malignant, cancer or non-cancer. So he recommended to go for an MRI. So a week later, because MRI is always demanding, and you need a long appointment, and 7 days is, a week is about the time where you normally would get one appointment. Sometimes it can be even longer. So the MRI results comes back as suspicious of breast cancer, and the radiologist asks for a guided biopsy of the breast lump, which is performed again a week later due to schedule for appointment. And the final diagnosis from pathology turns out to be breast cancer. And she went on to do a mastectomy, and the final report was breast cancer with lymph node metastasis. The problem is cancer early diagnosis is crucial. If there's metastasis, it means poorer prognosis. What if I say AI can predict breast cancer at the stage of mammogram instead of going to the MRI that you need about 1 or 2 weeks wait, and you can cut short the durations of diagnosis and possibly prevent metastasis. This is a paper published in Radiology by Brazilians and her team. They are from Harvard universities. Basically, this particular group uses deep learning, a form of AI, to look at 32,000 mammograms. And the AI is able to predict breast cancer risk accurately in 98% of cases. And when they compare AI with currently available the method of detecting breast cancer used by radiologists, AI perform much better. So but the problem is, what if? So would you like to have an AI to diagnose a disease? The problem is, if an AI make a mistake, who is to be blamed? And having said that, just now I mentioned 98% accuracy, which means there's a 2% possibility of mistake. And you have to know that AI is not human being, they lack human touch. The other example that I can give you is prostate cancer. So prostate cancer, pathologist uses what is known as the Gleason score for prognostications of a patient. And in this Gleason score, there is score 1 to 6 based on the pattern of the tumor cells. This paper is published in Modern Pathology. They look at AI-assisted scoring by pathologists and pathologists not using AI to score. And they found that pathologists that is AI-assisted perform better than the one that has no AI assisted. So on top of this, AI can also be used in drug design and drug discovery. Clinical trial in drug discovery is very expensive, and most of these drug discovery in clinical trials fail. And maybe AI will be able to reduce the number of failure. AI can also be used for hospital management. It can also be used for precision medicine. AI will be able to identify genetic or proteomics biomarkers that are specific for certain disease for other therapy.
Prof. Tan, you have 1 minute more.
Oh, okay, thank you, Dato. So I think my take is that AI is not going to replace us. We should work together with AI to provide a better healthcare to the society. And very quickly on my last second question would be how digital health, how COVID pandemic affects or influence digital health. I'll just give you, so COVID pandemic has affected everyone in every single possible way. And during the MCO, only 20% of the workforce are allowed to work and 20% have to stay back and work from home. Patients are unable to attend hospital for follow-up. And the hospital is overwhelmed with COVID patients. And telemedicine, digital pathology, and telepathology will be probably the most suitable way to counteract this particular problem. So I think I'm not going to waste too much time. So my take is on this is that the COVID pandemic is going to be here for some time, and we have to embrace the change or we will be changed. Thank you.
Thank you, Prof. Tan. We'll go on to the Dr. Prathaban Raju. He is founder of Door-to-Door Doctor. He is co-chairperson of the Digital Health Malaysia Special Interest Group 1, and he was formerly Chief Commercial Officer of the Malaysian National News Agency, BERNAMA. Dr. Prathaban Raju.
Hi, Prof. Thank you. And good afternoon, everyone. I hope you all can hear me.
Yes.
Okay, great. So yeah, I'll try to stick to the 8 minutes and try not to do too long of an introduction. I hope you all can see my slides.
Yes.
Yep. Okay, so I've just got a QR code on the bottom right over there so that will link you to my profile. But I kind of want to start with this statement. I got involved in digital health about 7-8 years ago, and we have not seen anything like the acceleration and the digitalization we've seen in the last 17 months. Okay, in my last job or contract that I did, right, I was involved with getting on board close to 1,000 healthcare professionals onto a digital health platform, and I'll be sharing some of those learnings that I had during that process. But let me first start with 7 years ago, right? So 7 years ago, with the first startup door-to-door doctor, we were already doing some form of digital health, by looking at our patients remotely, looking at their wounds while our nurses were doing dressing and recommending, what's the next change to be done. That was the time of 4G first becoming mainstream, and probably you all will remember the iPhone 4 coming out at that time. Now, as I went along, I was really interested in the technology and came into the space of hospitals, right? Hospital information systems. That's where I actually learned that we doctors do not know much at all about, how hospitals operate, and definitely not at all about the digitalization of it. All of those lessons fast forwarded today, and I'm really very, very happy to see the kind of, corona bump impact, okay, that our clinicians have taken on to and coming on board to this digital health train, right? So I'll jump straight into the case study of onboarding close to about 1,000 specialists, general practitioner doctors, physiotherapists, speech therapists, psychologists, right? So the bulk of them were actually clinical specialists, surgeons, dermatologists, orthopedicians, things like that. So when we started off at the first wave, okay, was when I got on to this project, right? And this was when we understood that, okay, telemedicine had become mainstream. The hospitals asking us for a solution. So our biggest challenge was that most doctors were not interested, right? And it was difficult to mobilize, even more difficult to mobilize our general practitioners. So this was the biggest challenge in the first wave. Well, that went off after a couple of, I think about 2 months, maybe 2.5 months, right? And we got back to almost, patients walking in and hospitals operating as normal. And then comes the second wave. So what happens in the second wave is that most of these 1,000 doctors, okay, their initial skepticism begin to clear, okay? And the hospitals then start realizing, hey, if my patients can't come to my hospital, we have to disperse them. We can't have too many people waiting. I need to prepare something that will extend my hospital's physical, boundaries to treat them remotely, as Mr. Tirupathi had said earlier, right? We want to extend the boundaries of just the brick and mortar healthcare institutions. Now, this MCO didn't last very long. So as the doctors were getting on board, they quickly oh, okay, my patients are coming back, so interest was lost. Well, since then, we've been in a third wave, and a monstrous wave that is, okay, whereby now we see increased interest in clinicians, okay, and there's only a few batches, right, that initially adopted during the first wave who now are actually using it as a common daily part of their treatment plans. Right, and the other big problem that we started to see is that there were people asking for specialties, but the specialists in those fields were not really keen to consult, due to the various reasons I will share shortly. So just deep diving on the challenges, right? So the first one was actually the clinician. When we board a plane, the pilot flies it and determines our direction. So similarly in healthcare, the patient will always look at the doctor for the next step. What do I do next? If you're going to call me, you're going to speak to me online, you're going to come to the clinic. So this was the first one. And then a lot of clinicians, everyone, no, you cannot do teleconsult because you cannot touch, feel, and see the patient. But this mentality took time to change, okay? We had to train clinicians to say that telemedicine is just another layer. You do not replace the clinical visit. In fact, with this layer, you get to have better, closer communications, and it's a huge benefit for the patient especially. And finally, the first challenge is that, out of say the initial batch of say 100 doctors, only 15 or so were actually active, and out of that maybe you need 3 to 5. So we're talking about an early adopter rate of, very poor early adopter rate. Most industries would determine an early adopter at about 16.7% before you go to your early majority and late majority in terms of marketing, right? Market sizing. The second challenge is actually one that I've been very passionate about for the past 5 years. As Prof. Jai introduced, there is a special interest group that looks at regulation and policy. It's used to be co-chaired by the Ministry of Communications and Multimedia and also Ministry of Health. However, with the recent challenges we've been facing, we've moved that to an organization called Digital Health Malaysia. Okay, it's actually you can actually go and look for it and register as a member. But yeah, there are actually no clear guidelines. What's right, what's wrong, and whenever there's so much of ambiguity, everyone becomes a legal expert. All right, and this is when we discuss gray areas, polarizing views tend to just prevent things from moving forward. And something clinicians always talk to me about is actually data privacy and privacy concerns. And I always try to explain to them that, at my previous job, Stratec, we also used to manage data centers in which, the whole entire business is about data security and privacy. What I would like to actually tell my fellow clinicians here is that the standards of data privacy and security currently are actually very, very, very high. Okay, so trust your cloud service provider or your database provider, the experts that know how to manage this, and follow their protocol. Do not share your email address and passwords to begin with. Okay, the third challenge, payer and provider. So there were no clear pathways for teleconsultation to be paid for from an insurance angle, or for the hospital to claim, or even for the clinician to claim. So this led to a lot of troubles with like adoption as well in the beginning, especially since most of these services were being, most of the doctors were actually being onboarded from private hospitals. Okay, and the last one is of course the indemnity and the malpractice. So only a few companies actually come out and declare that, hey, we are covering telemedicine. So I believe that there are these companies that cover. Please do message me. I will like guide you to some, direct you to some of them. And the last thing is about, of course, the lack of coverage, the lack of awareness amongst clinicians. Yeah. Okay, I'm on my second last slide. Okay, and I just wanted to kind of put forth my thoughts, okay, on the future. Yeah, we've covered like 7 years ago. We've spoken about in the last 17 months, the challenges getting, these 1,000 doctors on board, and like, what are we looking at in the next couple of years? All right. So I believe that the true impact of digital health will only be realized when the ecosystem and the systems, okay, actually exist together. Now, we're not just talking about talking to the patient through a video call. We're talking about the home monitoring devices, the patient management systems that remind the patients of appointments, the sharing of databases. It's a good move that right now data is being a bit more liberalized. I think KKM has got onto GitHub. I hope that more data will be put inside there so developers can do more. But yes, the true impact of digital health will only happen when the entire ecosystem exists. The next one is regarding medical leadership. Okay, we doctors are, generally thought of to be a smart bunch of people, but I think after looking at, looking at things from the tech industry, from the oil and gas industry, from the news and media industry, which was very interesting, my stint at BERNAMA, there is so much that we can learn. Okay, first of all, about culture. Okay, and the second one is actually about their methodology, their thought processes, things like design thinking, agile. How do we incorporate all of these, to really find solutions to drive us forward, and experimentation. Okay, now the key challenges that we will face. Number one, clinicians. We doctors need to take this step forward, okay, and lead the patient care. And putting layers of teleconsultation, telemedicine, remote monitoring, ECGs being reported on cloud, radiology, ultrasound scans, being co-consulted with a specialist. That's number one. Second thing is infrastructure. We've got all these databases here and there, and they hardly ever talk to each other. So what is the interoperability? Are we going to be implementing standards like FHIR and HL7 for the industry? Right now, it's a matter of like client asks, we provide. If not, they tend to save on that cost. The third one is policy and regulation. Now, this is something that is going to take many years. I hope that we can actually start this process, or like the process has started. I just hope that, this COVID-19 pandemic learnings will accelerate that. And the final one is actually the payer-provider reimbursement. Mr. Tirupathi, Mr. Karthik, if the insurers jumped on board, I guarantee you that the level of savings, data that we'll be able to analyze, and we'll probably be able to move into value-based healthcare a lot sooner, right? And I hope that we all can come together to do that soon.
Okay,
right?
Dr. Raju,
And
can we have your concluding remarks?
absolutely. So the last one is a bit unfortunate because we've taken some time to actually come to this spot. I believe that we might actually realize the benefit of digital health after we control the pandemic, but that's fine because my concluding remark for everyone is that digital health is something that the rocket has taken off. It might not have gone into space yet or just breaching our stratosphere right now, but it's not turning back. Okay, we're not going to go back to the counter to withdraw money anymore. ATM machines, and we're not going to grab e-commerce buying vegetables delivered to your house. These things are not going to change. So please, I urge my fellow colleagues and my all our partners and all the people in the industry, get on board. Digital health is a rocket that's already taken off. Thank you.
Okay, thank you, Dr. Prathaban. Raju, I was planning to make some concluding remarks, but you have stolen my thunder. Nothing much left for me to say now. So can I get back to that topic? The questions that came up in chat have already been answered in chat. So can I now come back to the title once again, Trends and Insights for 2021-2022. So can I go back to the panelists and ask you one trend or one insight you want to share with us before we end the panel? Can we start with, Mr. Tirupathi?
Sure, thank you, Dr. Jan. My point is that virtual care is the answer in delivering care anywhere. Barring surgeries and acute conditions, there is no real reason for hospital visits. So one thing I would like to place in front of everyone is perhaps the time has come to set up 100% digital hospital and totally get away from this mindset of physicality of healthcare facility that we've built up. Obviously, to do this, we'll have to give up all the sacred cows that we have surrounded our mindset with. But if there is something that I see coming, it's probably just this, in my view. That's my hope, aspiration, and also a prediction for the future.
Okay, Dr. Ashish, your insight or trend?
I believe that on the digital health front, there is a lot of scope, and I believe that there is already a lot of movement which is happening to build an health ecosystem. So it's not just one particular aspect about health, but there are different aspects which will all come together, and we will see more and more platforms coming up which will aggregate all this different solution from the different vendors, and there will be increased uptake as the awareness of the importance of maintaining good health. There will be increased uptake by the consumers, and we will be seeing a really high uptake of and utilization of such digital health.
Okay, thank you. Prof. Tan, the future trend and go beyond pathology, please.
Okay, thank you, Dato. So the future is now. So we need to embrace the change to telepathology, telemedicine, digital health. That's my take. Thank you.
Okay, thank you. Dr. Prathaban, anything left to say? Last remark? Trend?
Sorry. Still the most famous term in 2021, you're on mute. I know, Dato, I still want to conclude with, the train has left the station. It's a rocket ship, get on board. But perhaps there's a comment from Dato Dr. Syed Hussain Said Husman, okay, that has a bit of a hope here. I think now with the pandemic, after the lockdown, digital approach will become more accepted. I hope it will, as it will provide better services to the clients than being there personally. Also, quick advice can be given. Absolutely, Dato Doctor, and I hope that you will also advocate that amongst our colleagues and clinicians. Yeah.
Okay, thank you. I kept you for last, Dr. Feisul, because you have to address some of the biggest challenges, and hopefully you will see digital health as part of the solution. We have aging population, we have chronic diseases to manage, and those are some of the roles that you play in the Ministry of Health. So what is the hope that digital health can deliver in the future healthcare system?
Thank you, Dato. Not so much hope, but concern, really. If you look at the population, there are vulnerable groups, and the vulnerable groups are more susceptible to NCDs, so even COVID-19, just because of their socio-economic circumstances. So when we talk about digital health being, the new health economy, consumer-driven, my main concern would be digital health initiatives widening the already existing inequalities and inequities that we already see, just by the virtue of the fact that they engage with technology. When I say they, vulnerable groups engage technology differently from those who are at lowest risk. I mean, this group of people probably listening in, we are low risk. So I hope people working in the digital health space think about vulnerable groups, think about low tech as well. While AI is important, I think we need to really think about how it will benefit the vulnerable population. Back to you, Dato.
Okay, thank you, Dr. Feisul. Now, in this panel, unfortunately, because of maybe the makeup of the panelists, the discussion has been quite largely provider-centric. We are talking about what we can do for people. But I think a lot of what is happening in the digital health space is actually consumer-driven and consumer-centric. So social media is playing a big role. The availability of broadband, 5G, 3G, peer-supported groups, consumer developed portals, all these things are going, and of course, the use of mobile devices, sensors, all these are going to add power to consumers, to patients, and they are going to drive many of the developments in digital health. So it is something that we have not entirely addressed. The great thing is we needed a crisis like COVID-19 pandemic to drive those sort of changes in the environment that has propelled digital health to the increasingly important role it is playing today. Now, in a measure of the use of telemedicine, interestingly, there was increasing use of telemedicine in the US, for example, until September 2020, after which the use of telemedicine plateaued. Why did it plateau? Is it because the present users of telemedicine or digital health have reached their limit of their ability to utilize these new technologies? Do we need a new generation to come forward and re-look at it differently and drive further adoption of digital health and its utilization in improving health outcomes and solving the problems of today's pandemic, tomorrow's health crisis? And finally, what sort of students are we preparing? Are they ready for the challenges that these disruptive technologies are going to bring and make available? Are we training them right? There was a book written on cosmic students and disruptive technologies. Now the question is, are our students prepared for this sort of disruptive thinking? Are they going to be innovative and entrepreneurial? And are they going to drive forward the digital health of the future? Now that is for our universities to look at and address. So with that, I would like to thank the panelists for their very valuable contributions. And we hope that this conversation can be continued somewhere else. Thank you very much.
Thank you very much.
Thank you, Dr.
Thank you
Thank
very
you,
much.
Prof. Thanks, everyone.
Thank you. Thanks, everyone.